We go now to our reporter Lora Windsor, who has more on diet and heart disease.
Poor eating habits can lead to many diseases, so a poor diet and heart disease go hand in hand. We spoke to certified nutritional consultant Brenda Watson, author of Heart of Perfect Health. We asked her about the role of diet, especially sugar and carbohydrates, and heart disease.
Diet plays a very important part in heart disease, and especially sugar and carbohydrates. Sugar and carbohydrates feed silent inflammation, which in turn creates high blood pressure, high cholesterol, and of course, high blood sugar. So it's very important to understand the role of sugar and heart disease, and the fact that most people can understand sugar in terms of a soda or a cookie, but they do not understand that carbohydrates turn to sugar in the body also. And that's one of the biggest reasons we are not able to control the obesity epidemic, is because the average person cannot convert carbohydrates into sugar into a form that they can understand, into a measurable form. A person has approximately 7 liters of blood in their body, and in each moment they need about 1 teaspoon of sugar to remain stable. And over a day, the average person needs 8 to 10 teaspoons of sugar to maintain normal blood sugar levels. But what happens is the average person gets anywhere from 37 to 86 teaspoons of sugar a day. So what I'm showing people how to do is have a simple formula in which they can take all their carbs, their fruits, their vegetables, and convert those into teaspoons of sugar. And they can count from 8 to 10 very easily and get their level of sugar and carbs down. The formula is, if you're reading a label, you take the amount of carbs minus the fiber, divide it by 5, and that's how many teaspoons of sugar are in a serving of that food. The average pasta serving is 2 ounces, which isn't very much, and it's about 43 grams of carbs. You minus the 3 grams of fiber, and you end up with 40 carb grams. If you divide that by 5, you get 8 teaspoons of sugar in 2 ounces of pasta. That's why people are still obese. They don't understand this conversion of carbs into sugar in our body is the same as having a soda.
How important is fiber in your diet, and what role does it play in the prevention of heart disease?
Fiber, when you take it in, soaks up in the digestive tract cholesterol, toxins. It helps manage your blood sugar. It also helps in, of course, keeping you full so that you don't overeat. There are 2 kinds of fiber, soluble and insoluble. So soluble fiber soaks up, insoluble fiber cleans out. And that's why soluble fiber helps soak up cholesterol, helps you manage blood sugar, and helps soak up toxins in the digestive tract. These fibers are found in your fruits, vegetables, nuts, seeds, and grains. But in many cases, the average American's getting about 12 to 15 grams of fiber a day, and we need to be getting anywhere from 25 to 35 grams. So in many cases, they do need supplemental fiber to add into their diet every day, and these can be purchased at any health food store. They have good organic fibers. It's all awareness. So if you learn in that simple formula to convert your sugar in a serving of whatever you're eating into teaspoons of sugar, and you know that you need 10, and say you get 15 a day, you're still going to be better than the average American, then that's the way to control it. It's awareness. My mission is to make you your own health advocate. That's my mission. You control your health.
Having a healthy diet can help keep your heart in check and is an important step towards preventing heart disease. For the American Health Journal, I'm Lora Windsor.